When 72-year-old Margaret walked into the emergency room with crushing chest pain, the doctor barely looked up from his clipboard. "It's probably just heartburn," he said, without even examining her properly. 3 hours later, she was in emergency surgery for a massive heart attack. That delay nearly cost her life. At first, I thought Margaret's case was a tragic one-off. But after years spent inside hospital corridors, medical conferences, and backroom discussions, I uncovered something far more disturbing. What happened to her wasn't an accident. It was a symptom of a hidden bias inside modern healthcare. A bias so widespread and so deeply rooted that millions of seniors are affected every single day. A trillion-dollar system where time pressure, profit margins, and unconscious assumptions quietly decide who gets life-saving treatment and who gets written off before the examination even begins. What shocked me most were the private notes doctors use to describe older patients' phrases I've personally seen in medical records. One of them is so demeaning that when we get to number 5, you'll understand why some seniors never receive the care they deserve. And at number 2, I'll show you the emergency room statistics that prove seniors are treated under a completely different protocol. The outcomes are devastating. Today, I'm going to reveal the 5 harsh truths about what many doctors really think when they see a patient over 60. The assumptions they make before you even speak. The biases that can lead to misdiagnosis, delayed treatment, or outright neglect. And more importantly, I'll show you how to protect yourself and demand the care you deserve every time you walk into a doctor's office. If you're over 60 or love someone who is, this video could save a life. So let's begin.
Every study I mention is listed in the description. Never accept information blindly, not from me or anyone else. Take a moment to look at the research yourself. Before we get started, let me ask you something. How old are you, and where in the world are you watching this from? Share it in the comments. I personally read through all of your messages, and your experiences are what inspire me to create these videos. Truth number 1. You're too complicated. Here's what happens when you walk into a doctor's office as a senior. Before you even sit down, many physicians are already making assumptions. They see your age and immediately think, multiple conditions, multiple medications, complex case. A study published in the Journal of the American Geriatric Society found something disturbing. Doctors spend significantly less time reviewing medical histories for patients over 65. The reason? They assume complexity equals hopelessness. Dr. Sarah Chen, a geriatrician at Johns Hopkins, revealed in an interview that her colleagues often say things like, "another complicated elderly patient," in private conversations. This bias leads to something called therapeutic nihilism. That's when doctors essentially give up before they start. They order fewer tests, explore fewer treatment options, and accept symptoms as normal aging when they shouldn't. Take John, age 68, who complained of memory issues. His doctor immediately assumed dementia and never tested for vitamin B12 deficiency. A simple blood test later revealed the real cause. A completely treatable condition. But months of cognitive decline could have been prevented with proper investigation.
Truth number 2. You're non-compliant. The second bias is equally dangerous. Many doctors assume seniors won't follow medical advice. They label older patients as non-compliant before giving them a chance. Research from Harvard Medical School shows that physicians are 40% less likely to explain treatment options thoroughly to patients over 60. Why? They assume you won't understand or won't follow through. Dr. Michael Rodriguez, who has practiced internal medicine for 20 years, admitted something shocking. We often simplify explanations for elderly patients, sometimes to the point where we don't give them enough information to make informed decisions. This creates a dangerous cycle. Doctors provide less information, patients ask fewer questions, and physicians interpret this as disinterest or inability to understand. The result? Substandard care based on false assumptions. Maria, 74, was prescribed a new medication for her heart condition. Her doctor gave her a 2-minute explanation and rushed to the next patient. When Maria experienced side effects and stopped taking the medication, she was labeled non-compliant. No one bothered to ask why she stopped or address her concerns. Her condition worsened, and she ended up hospitalized. Truth number 3. You're hiding symptoms. The third truth reveals another dangerous assumption. Many doctors believe seniors minimize or hide their symptoms. While some older adults do downplay complaints, physicians often use this as an excuse to dismiss legitimate concerns. A study in the Annals of Internal Medicine found that doctors are more likely to attribute symptoms to normal aging. In patients over 60, pain becomes expected arthritis. Fatigue becomes getting older. Confusion becomes senior moments. But here's the problem with this thinking. It leads to serious conditions being overlooked or misdiagnosed. Dr. Lisa Thompson, an emergency medicine physician, shared a troubling observation. I've seen colleagues dismiss chest pain in elderly women as anxiety when they would immediately order an EKG for a younger patient with the same symptoms. This bias particularly affects older women who already face gender bias in medical settings. The combination of age and gender bias creates a perfect storm for misdiagnosis. Ruth, 69, visited her doctor 6 times, complaining of shortness of breath. Each time, she was told it was normal for someone her age. When she finally collapsed at home, tests revealed severe heart failure. Early treatment could have prevented months of suffering and a life-threatening emergency. Truth number 4. You're too time-consuming. Here's a truth that cuts to the heart of modern healthcare problems. Many doctors view senior patients as time-consuming burdens on their schedule. The average medical appointment is scheduled for 15 minutes. But seniors often need more time to explain symptoms, ask questions, and understand treatments. Instead of adjusting for this reality, many physicians feel frustrated and rush through appointments. Dr. James Wilson, a family medicine doctor, revealed something that happens in medical practices across the country. There's an unspoken understanding that elderly patients will take longer, and some doctors actually try to limit the number of senior patients in their practice. This time, pressure leads to several dangerous outcomes. Important symptoms get overlooked because there's no time for thorough examination. Medication interactions aren't properly reviewed. Patient concerns are dismissed or ignored. And follow-up care gets delayed or forgotten. Studies show that seniors are 30% more likely to have their appointments cut short compared to younger patients. The message this sends is clear. Your concerns aren't worth the time. Frank, 71, tried to discuss 3 health issues during his appointment. His doctor addressed only the first one and told him to schedule another visit for the rest. By the time Frank got his next appointment 6 weeks later, one of his untreated issues had become a serious infection, requiring hospitalization. 5. You're less deserving of aggressive treatment. The final truth is the most disturbing of all. Many doctors unconsciously believe that seniors are less deserving of aggressive or life-saving treatments. This bias affects everything from cancer treatment to emergency care. Research published in the New England Journal of Medicine revealed shocking disparities. Patients over 65 are significantly less likely to receive certain life-saving treatments even when they're good candidates. Dr. Patricia Martinez, an oncologist, witnessed this bias firsthand. I've been in tumor board meetings where age becomes a factor in treatment decisions even when the patient's overall health would support aggressive treatment. This isn't just about end-of-life care or patients with multiple health problems. It affects healthy seniors who could benefit from the same treatments offered to younger patients. The assumption is that older lives are somehow less valuable, or that treatment benefits are automatically reduced because of age. Emergency rooms are particularly affected by this bias. Studies show that seniors wait longer for pain medication, receive less aggressive initial treatment, and are more likely to be discharged without proper follow-up. When 7-8-year-old Robert arrived at the emergency room after a fall, despite his complaints of severe back pain, he waited 8 hours for an MRI. The scan revealed a serious spinal fracture that required immediate surgery. The delay could have resulted in permanent paralysis. Now that you know these 5 harsh truths, let's talk about how they directly impact your medical care. These biases lead to several dangerous outcomes. First, misdiagnosis becomes more common when doctors make assumptions based on age rather than symptoms. Second, treatment delays occur when physicians don't take senior patients' complaints seriously. Third, substandard care happens when doctors provide less thorough examinations or explanations. Fourth, medication errors increase when doctors don't spend adequate time reviewing drug interactions. And fifth, emergency situations become more dangerous when bias delays critical treatment. The statistics are alarming. Seniors are 40% more likely to experience diagnostic errors compared to younger patients. They're also more likely to receive inadequate pain management and less likely to be referred to specialists when needed. Protecting yourself. Your action plan. But here's the good news. Knowledge is power. Now that you know about these biases, you can take steps to protect yourself. First, prepare for every medical appointment. Write down your symptoms, questions, and concerns before you go. Don't let doctors rush you through your list. Second, bring an advocate with you when possible. Studies show that patients with advocates receive better care and more attention. This could be a family member, friend, or professional patient advocate. Third, ask direct questions and demand clear answers. If a doctor dismisses your concerns as normal aging, ask them to explain exactly why they believe this. Request specific tests or referrals if you feel they're needed. Fourth, get second opinions for serious diagnoses or when you feel your concerns aren't being addressed. Don't let anyone make you feel guilty for seeking additional medical input. Fifth, document everything. Keep records of your symptoms, treatments, and doctor interactions. This information can be crucial if you need to advocate for yourself with other healthcare providers. Sixth, learn to recognize red flags. If a doctor seems rushed, dismissive, or makes assumptions based on your age, consider finding a new provider. Seventh, know your rights as a patient. You have the right to receive the same quality of care regardless of your age. You have the right to ask questions and receive clear explanations. And you have the right to refuse treatment or seek alternatives if you're not comfortable with the recommended approach. Final recommendations. Remember, not all doctors have these biases, and many are working hard to provide excellent care to seniors. But awareness of these issues helps you identify when bias might be affecting your care. Don't be afraid to speak up, ask questions, or seek additional opinions. Your health and life are too important to let unconscious bias determine your medical treatment. The key is to be informed, prepared, and assertive in your healthcare interactions. These 5 harsh truths about medical bias against seniors are uncomfortable to face. But ignoring them won't make them go away. Margaret, the woman from our opening story, survived her heart attack and learned to advocate for herself. She now brings written questions to every appointment and doesn't leave until she gets satisfactory answers. John got the B12 treatment he needed, and his memory improved dramatically. Ruth's heart condition is now properly managed with medication that could have been prescribed months earlier. Your age should never determine the quality of medical care you receive. By understanding these biases and learning how to counter them, you can ensure you get the treatment and respect you deserve. If this video opened your eyes to something you didn't know before, give it a like and share it with someone who needs to see it. Have you ever experienced age bias in medical settings? Share your story in the comments below. Your experience could help others recognize and address similar situations. And remember, being older doesn't make you less deserving of excellent medical care. It makes you more deserving of doctors who understand and respect your experience. Don't let anyone tell you otherwise. Health Guide.